Why do we even need AI? It's flashy, it's cool, it sounds great, but we've been doing this for years. My dad practiced dentistry for 44 years. He did okay. Every dentist thinks they're pretty good. Every dentist thinks they have the correct diagnosis. Not a lot of dentists would tell you, oh, yeah, I make mistakes all the time. So, why do we even need this? I taught at a dental school for 9 years, and my students coming out of school, they thought they were pretty trained. Well, it turns out that we have a consistency problem in dentistry. You may remember there was an article through Reader's Digest a few decades ago, and an investigative journalist went to 50 different offices and he got 50 different treatment plans, 50 different diagnoses from dentists. This is difficult for consumers, for our patients, because all of those dentists think they're right. And all of those dentists think the other dentists are probably wrong. When you go to dental school, you feel trained. You feel like this is what I do. And as good as we think we are, we do have an inconsistency problem. And this has been studied many times, but here's a few examples. So one study we did at Pearl on the right here looked at the detection of carious lesions. We looked at almost 9,000 images. We had 3 different doctors, and we wanted to see how consistent they were in relation to the other. When you combine the images where all 3 doctors saw caries, you only had 4.3% of a unanimous decision. So you had some doctors that found caries in 16% of the images, some doctor that found it in 5%, and some doctor that was kind of in the middle. And this is what you see. Who's right? Who's really right in that situation? That's difficult as a patient if you went to these 3 doctors not knowing who to trust. Another study that we did through the Dental AI Council, which is a nonprofit organization that we helped to found, we looked at variability in diagnosis and treatment planning. So we took an FMX, we took a full set of radiographs, and we showed 136 doctors. And we asked them to diagnose and treatment plan based on the radiographs. And we got treatment plans from $300 to $36,000. Imagine being that patient and going to one doctor, they say it's $300. Another doctor says it's $36,000. It's the same mouth. And then specifically when we dove into, different teeth within the mouth, we looked at this upper right molar, and on that specific tooth, we had 51% of doctors that said there was no caries, 49% of doctors said there was caries. It's almost a 50-50 split. And that isn't good for our profession.